What are you doing?
I'm letting the staples off.
This was a joyful moment. A young couple excited to become parents for the first time, revealing the gender of their baby.
Oh my God.
But filming this took immense effort for mum-to-be Jess Cronshaw, who was desperately ill and struggling to get help.
She couldn't drink, she couldn't eat, her weight was dropping off her, her skin was white, she weren't Jess. She weren't Jess.
While pregnant, the once ambitious, active and independent 26-year-old became unrecognisable. In voice messages to her friends, Jess sounded far from the woman they knew.
Honestly, it's like the hardest thing I've ever gone through in my life. Like the constant nausea, like there's no relief from it. And I just spend my days in bed till I can't. Honestly, I just can't. It's just horrible.
She was suffering from Hyperemesis Gravidarum, or HG, an extreme form of pregnancy sickness that brings on debilitating nausea and vomiting.
Did anyone at any point recognise how sick she was?
No. And that's what hurts more than anything, because I knew she did. It was like we were going everywhere but not getting anywhere, and it was really hard.
Lots of good ends.
Staff at the Royal Blackburn Hospital incorrectly told Jess to stop taking the anti-sickness medication she'd been prescribed. She was mistakenly led to believe the drug would harm her baby. You can see how gaunt she became in this photo of her holding her nephew. In November 2022, at 28 weeks pregnant, Jess took her own life. Her baby daughter Elsie was born by emergency C-section. After 4 days, the family were told their newest member wouldn't survive.
We had her christened with the vicar who were in the hospital. She got reunited back with her mum. She passed then, and then just passed the day after. There's no words, really. I can give you just... Oh, it broke. And living my life now feels like I'm lost.
At the inquest into Jess and Elsie's deaths in January last year, the coroner concluded that failings in Jess's care led to a deterioration in her mental health, highlighting the fact that she was given incorrect advice to wean off anti-sickness medication, and that she had not been referred to any mental health service or support.
That's all it would have took, one individual, professional, to do something for Jess, and it would have changed the outcome altogether. I know that, and I live with that.
This is obviously so difficult to talk about. Why are you talking to me?
Because I wouldn't want anybody to feel how Jess felt. No one there, she felt. No one was listening.
Hyperemesis gravidarum is the same condition that caused the Princess of Wales to be hospitalised in her pregnancies. It affects around 30,000 women in the UK every year. While there is no cure, for most women with HG, the right combination of anti-sickness medication will help them manage their symptoms.
Hi, Kathy.
Hi, how are you?
Professor Kathy Nelson-Piercy and her team at St Thomas's Hospital in London are experts in managing the condition so that babies like Bodhi are born to parents who've been properly supported. But the availability of such specialist NHS care is limited, and according to Kathy, there's a knowledge gap among medical professionals.
They remain very cautious about prescribing anti-sickness medicines, and they therefore either won't prescribe them, or they will only prescribe a small quantity, or they will imply in some way to the woman that they shouldn't be taking them, or that it's normal to feel sick in pregnancy. And it's the, it's hard for me as a healthcare professional to say this, but it's the attitudes of healthcare professionals that is what women will most often mention to us when we listen to their stories.
That was this couple's experience before getting care here.
I just was told a lot that it was morning sickness or just pregnancy sickness, and I think deep down I knew it wasn't. That in itself was a challenge to get through to people and try and feel like I was being heard.
What was the biggest thing that really made a difference for you guys?
They put me on steroids. I stayed here for about 2 weeks and was given everything through an IV drip, and that's when I started to see some progression. Anything we needed, they were there for us, from a mental point of view and physical.
Having a team to support me in supporting her made it a lot easier,
I'd just do anything not to feel like this.
The mental health impact of hyperemesis is something content creator and podcaster Em Clarkson is still dealing with. Her second daughter, Xanthi, was born just before Christmas. Her arrival brought overwhelming joy and intense relief at making it through another HG pregnancy.
When you're stuck listening to life go on without you, you do go really dark because you just think, well, they don't need me. No one needs me. And I just, that was really hard. I was not the wife or mother that I wanted to be. And I don't think we realised the toll that it had taken until we went into hospital to give birth. And we cried on the way in. And my husband is not an emotional person. I think we were just so relieved that it was done and we'd done it.
You know how they say everybody's fighting a battle that you know nothing about? That is not the case for me. We'll know a lot about the battle that I'm currently fighting because I don't shut up about it.
Em documented her illness and shared it with her followers in solidarity with other sufferers and in the hope of raising awareness.
I couldn't have pretended. I couldn't have gone about like everything was normal because it wasn't, and I wasn't okay, and I couldn't have done it. And those dark thoughts and that isolation, and I thought to myself, I can't let someone else be on their own with this. I can't do this on my own. I needed the community, and a lot of the messages were confused, and looking to me for advice and for help. And I was gutted by how many there were.
That confusion is something the charity Pregnancy Sickness Support deals with every day. A survey they conducted found that almost 60% of women rated the care from their GP as poor during their first HG pregnancy. For midwives, it was 48%, and while consultants fared better, 37% of women who saw one still scored those interactions as poor. Charlotte Howden and her team provide advice and advocacy for women with HG. She says, as well as the physical symptoms, the trauma the condition inflicts needs to be taken more seriously. And without improvements, she believes what happened to Jess Cronshaw could happen again.
It's my fear, and it's the fear of the charity, that this isn't a case of if, it's a case of when. And that's really sad. And this tragic case is a reminder of the consequences of inadequate care and treatment of women with Hyperemesis Gravidarum. It's pushing women to crisis point.
Precious memories from Jess's childhood are now painful to remember. The family should have recently celebrated baby Elsie's second birthday, and Susan believes Jess would be campaigning for change.
The reason I need to do this is because Jess would have been a fighter and wanted more to be done for HG, because she said, once I've had a baby, I'm going to really fight for people who've got this condition, and she would have done. I know she would. But unfortunately, she was unlucky. Her mental health really, obviously, deteriorated because her condition had, and she didn't get the right care.